What have you done?
They got changes like
My foot. Oh, okay. You want to come in? Cheers. So, Luke, what'd you do?
Well, I was playing footy on the weekend and I was running for the ball and I felt a bit of a pop behind my ankle, just down the bottom of my calf, and I fell over straight away and wasn't able to get back up, and it hurt a lot. It's still hurting now.
Okay, have you been able to walk around since?
No, I can't put my foot on the ground. I need to get some crutches to walk around. I need to hold on to walls. I just can't place that foot on the ground.
Yeah, can't move it at all or anything like that?
Can't move at all.
Okay, no worries. And could you get up and walk around at all, or...?
No, I had to be chaired off, had to be carried off. I wasn't able to put my foot on the ground at all, very sore.
Okay, no worries, let's take a look at it. Okay. So the first test we'll do is the Thompson test, and essentially what I do is I squeeze your calf and I expect your foot to go into plantar flexion, which is basically in that direction, and it's doing so on the right side, which shows that the Achilles tendon is intact. Whereas if I do it on the left side, your foot isn't moving at all. And that's because the Achilles tendon has ruptured, and so it's not moving into plantar flexion. It's just remaining neutral. The second test is the Mattel's test, and so essentially what I do is I flex your knees to 90 degrees, and normally what you'd expect is that the foot would be, can you just hold your feet there? Normally what you expect is the foot would be in plantar flexion, but when the Achilles tendon is ruptured, essentially the foot just drops into dorsiflexion as a result of gravity. So that's the Mattel's test. And the last one that I do is resisted isometric testing. So essentially I want you to push your foot into my knee as hard as you can. Yep, that's fine. So whereas if I try it on this side, so basically there's full contraction of, full muscular contraction against resistance. So that's a grade 5. And if I push with this side, there's no evidence of contraction against my resistance, which is a 0, and that's basically because those tendons are ruptured. So basically it appears as though you've ruptured your Achilles tendon. So you've got your calf muscles. They're obviously the ones back here, and then coming off the calf muscles is the Achilles tendon, and that inserts into this bone, and that's called the calcaneus. And essentially what's happened is over time, there's a few different theories as to how it comes about, but the overall thing that has actually happened is that progressively that tendon has been worn away by small little tears, and then when you were playing footy the other day, those small little tears weakened it and it eventually ruptured. Basically, you'll see it on this model here. So that's the Achilles tendon attaching to the bone.
So you've told me I've ruptured my Achilles tendon. Are you able to fix it for me?
No, I can't personally fix it, but there's a couple of different options. So essentially, there's surgery or there's conservative treatment, and I'll just explain to you what those are. So the two different types of surgery are open surgery and percutaneous surgery. Open surgery involves making a larger incision down the back of the foot, so just down there, and essentially what they'll do with percutaneous is make smaller incisions, and with both those types of surgeries they use anaesthetic, general anaesthetic, so you'll be asleep and you won't feel the pain, and they'll re-stitch the two ends of the tendon together. Open surgery is much more common, but the complications are higher in open surgery in comparison to percutaneous surgery. This is something you'll talk about with an orthopaedic surgeon. If you decide to go ahead with surgery, they'll outline this with a bit more detail.
Yeah. Okay, so if I have surgery, is it safe? Does it ever go wrong?
Well, there are risks. There's a 30% chance of the risks occurring. And essentially the risks involve, well, there's general risks involved with surgery. So there's the risk of maybe having bleeding complications or being allergic to the anaesthetic, which they'll test for before the surgery. There is the risk of there's a main one of basically the tendon re-rupturing, and we'll talk about that a bit later, just the differences between surgery and conservative treatment and re-rupturing, but there is also the risk of infection, and the risk that there won't be as much of a range of motion and strength in the ankle as what previously was had. There's some of the main risks associated. There's also the risk that the scar tissue that forms there'll be too much scar tissue and it might constrict neighbouring structures like nerves or blood vessels. So basically the risks of surgery that are occurring are about 30%, whereas the risks associated with conservative treatment are about 3%. So there's a pretty big difference between the two. And then the difference between re-rupturing, basically in the past, re-rupturing was found to be much more common with conservative treatment in comparison to surgery. But with new types of conservative treatment, where they basically encourage a lot more early sort of movement at the ankle and a lot better rehabilitation exercises, they've found the re-rupture rates with comparison between conservative treatment and surgery are exactly the same. So it's actually worthwhile considering not going ahead with surgery and just trying out this new type of conservative treatment because you don't have all the risks associated with the surgery and you end up with the same sort of result in the end. That's something to discuss with the orthopaedic surgeon. They'll probably be more inclined to offer you surgery because that's what their profession involves, but it's something that you can definitely look into. Yeah.
So would you recommend one or the other, surgery or conservative?
I would probably recommend conservative, and basically finding someone who specialises in the field to be able to help you through that. And that's basically it. I can make the referral for the orthopaedic surgeon if you want to have a chat to them anyway. You have to go with that.
Yep, happy to go ahead with that.
Okay, great.
Thank you.
Thanks, Luke.